Hello and welcome. When we hear the word therapy, a lot of us picture one specific thing, right? But the world of psychotherapy is actually huge, with all these different maps for exploring the mind. So today, we're going to unfold a few of those maps and take a look at the major ways we can approach psychological treatment. Okay, so let's get on the same page. What is psychotherapy, really? At its heart, it's a professional relationship that's designed to help you. It's not just a casual chat, it's a structured process that's all about changing those unhelpful behaviors and sparking some real personal growth. So here's our game plan. First, we'll look at therapies that dig into our past. Then, we'll jump to approaches that focus on our thoughts and actions right now. After that, we'll see how our support systems play a role. And to wrap it all up, we'll talk about how you can find the right kind of therapy for you. All right, first up, we're diving into the school of thought that really kicked this all off, psychoanalysis. I want you to think of it like a careful archaeological dig, but into your own mind. It's all about uncovering how those buried experiences from your past are shaping your life today. This is such a great way to picture it. Freud's big idea was that our mind is like an iceberg. That little tip you see above the water, that's your conscious mind, everything you're aware of at this very moment. But that massive, hidden part underneath, that's the unconscious. And it's driven by all these repressed feelings and instincts that just want what they want, right now. The whole point of psychoanalysis is that this hidden part has a huge influence on our daily lives. So how in the world do you get to that hidden part? Well, the process has a few key steps. It kicks off with something called free association, where you basically say whatever pops into your head, no filter. The therapist's job is to listen for patterns and interpret how your unconscious might be defending itself. And the goal of all this? Insight. That big aha moment when you finally see the connection between your past and your present struggles. Okay, let's totally shift gears. We're moving from digging into the past to focusing squarely on the present. Our second major approach is called cognitive behavioral therapy, or CBT. And it's less like that archaeological dig and way more like a mental fitness plan. It's super active, it's skills-based, and it's all about the here and now. At the heart of CBT is this simple but incredibly powerful idea. Your thoughts, your feelings, and your behaviors are all connected. They're a team. And what that means is, if you're stuck in a negative loop, you don't have to tackle everything at once. If you can change just one of those things, say your thought patterns, it can create this amazing positive ripple effect through everything else. And this model shows that idea perfectly. It's called the hot cross bun model. Just look at how one situation, like getting on a plane, can set off this whole chain reaction. It starts with a thought, like, this plane is going to crash. That fuels an emotion, fear, which then leads to physical sensations, like a racing heart. And finally, a behavior, like gripping the armrest for dear life. CBT is all about learning to spot these links so you can step in and break that cycle. And you break that cycle using some really practical tools. See, CBT is all about learning new skills. This could mean anything from spotting and challenging those negative thoughts that pop up automatically, to scheduling positive activities into your week, or even breaking down a big, scary goal into smaller, totally doable steps. It's a very hands-on way to change your mental habits. So everything we've talked about so far has been about individual therapy. But what about the power of the people around us? Our third category of therapy is all about leveraging our relationships as a primary tool for healing. This is just such a powerful idea, isn't it? One of the most amazing things about group therapy is that moment of immense relief when you realize you're not the only one going through this. It just shatters that sense of isolation that so often comes with our personal struggles. It's more than just getting support. It's about seeing your own story in someone else, and that can be incredibly validating and a huge catalyst for change. And this same idea applies to our closest relationships too. In family or marital therapy, the focus totally shifts. Instead of zooming in on one person and labeling them the problem, the therapy looks at the whole system, the family unit, or the couple. The therapist examines the communication patterns, the unspoken rules, all the dynamics that everyone is a part of. The goal isn't to fix one person, but to improve the health of the relationship itself, which makes things better for everyone. Okay, so we've looked at digging into the past, managing the present, and using our relationships to grow. And that brings us to the biggest question of all. With all these different maps out there, how do you find the right path for you? This slide breaks it down really nicely for us. If you're hoping to understand some really deep, long-standing patterns in your life, a psychoanalytic approach might be a great fit. If you're dealing with something specific, like anxiety or a phobia, and you want practical skills to manage it, CBT is often the go-to. And of course, if your struggles are really centered around your relationships, then group or family therapy could be the most direct route forward. And honestly, this is the most important thing to remember. There is no magic bullet here, no single best type of therapy. What really works is finding the right combination, an approach that clicks with you, and a therapist you feel you can trust and connect with. Just understanding what your options are, that's the first and most powerful step you can take. I mean, it's a feeling so many of us know, isn't it? That sense of being trapped in a pattern you just can't seem to break. Well, that's one of the biggest reasons people decide to seek help. It's really the starting point for a journey to understand not just the problem itself, but the whole mental landscape where it lives. So we've laid out a few of the maps people use to navigate the mind, which brings us to a final question, just for you. Now that you have the map, what part of your own mind are you most curious to explore?
All right, let's jump right in. We are tackling a huge question today. How in the world do we even start to map the incredible complexity of the human mind? We're going to explore the systems, the literal maps that bring a sense of order to the world of mental health. So, let's dive in. I mean, just think about that for a second. How do you bring order to the chaos of the human mind? Our thoughts, our feelings, our behaviors. It's also incredibly complex and deeply personal. So how on earth do you build a system that makes sense of all that? And this isn't some new problem. This is a challenge that medicine has been wrestling with for centuries.
And for this ancient challenge, the answer really boils down to one key idea: classification. I know it might sound a little bit clinical, a little dry, but it's all about creating a shared language and a solid framework to help us navigate the vast territory of the mind. Essentially, it's about creating a map.
Okay, so why bother? Why do we even need a map like this? I mean, isn't it a bit simplistic, putting labels on something so deeply personal? Well, as it turns out, the reasons are actually super important, not just for doctors and clinicians, but for patients too.
So at its very heart, classification is just about creating order out of what can feel like total chaos. You look at this huge range of symptoms and experiences, and you start to group them. Things that seem to go together, well, they go in one bucket. Things that are different get separated into another. The whole process is about creating a common ground, a shared starting point so everyone's on the same page.
And this whole process really has three main goals. First up, communication. This one's huge. It means a doctor in one country can say major depressive disorder, and a doctor on the other side of the world knows exactly what cluster of symptoms they're talking about. Second, comprehension. It gives researchers a framework to actually study the underlying causes. And third, prediction. It helps us get a sense of the likely course of a condition, and most importantly, figure out the best way to help.
But hold on, before you can classify anything, you have to agree on what it is you're classifying. Think about our map metaphor. Before you can draw the map of a country, you have to know where the borders are, right? It's the exact same thing in psychiatry. We have to define what actually counts as a disorder. And here is the modern clinical definition that people work with. Now, it's a bit of a mouthful, so let's break it down. It has to be a clinically significant syndrome. That just means a recognizable pattern. But here is the absolute key. It has to cause genuine, real-world problems. We're talking about significant personal distress, or a disability that impacts daily life, or a major loss of freedom.
This slide does a fantastic job of clarifying those borders, showing what a disorder is, and just as importantly, what it isn't. So it's seen as a dysfunction happening inside a person. It's not just behavior that goes against social norms. And this part is so crucial, it's not an expected or understandable reaction to a tough life event. The example of grief after losing a loved one is perfect. It's an intensely painful but normal human process, not a disorder. That distinction is absolutely key.
Which, of course, brings up the elephant in the room, right? If we're going to define what's disordered, then we have to have some idea of what's normal. And, as you can probably guess, it is not that simple. There are a few different ways to look at this. The medical model is pretty straightforward. Normal is just the absence of disease. The social model looks at what's considered culturally okay behavior. But a really powerful idea these days is the continuum model. It suggests that mental health and illness aren't like a light switch that's either on or off. Instead, it's a spectrum, and all of us exist somewhere along that line. So, with those big concepts in place, let's look at the actual guidebooks that clinicians use every day.
When you boil it all down, there are two major systems that really dominate the field all over the world.
So, in one corner, you've got the ICD-10. This comes from the World Health Organization, the WHO, and it is the global standard for all diseases. I mean, everything from the flu to heart disease. And in the other corner is the DSM, published by the American Psychiatric Association. Now, while it's in its 5th edition now, we're looking at the super influential IVTR, which, unlike the ICD, focuses only on mental disorders. Now, since that ICD-10 system is so massive, covering every disease imaginable, they had to keep it organized. So they put all the mental and behavioral disorders together in their own section, Chapter F. It's really just a big filing system. So every condition gets its own F code, like F20 for schizophrenia or F32 for a depressive episode. But here's where things get really interesting. There was a huge realization in the field that just a single label is rarely enough. To truly understand what's going on with a person, you need a much more complete 360-degree view. The big problem with just one label is that it can be really stigmatizing, and it's just so reductive. A person is so much more than their diagnosis, and this simplistic approach risks ignoring all the other factors in someone's life that are vital for actually understanding their situation and giving them the right kind of help. So to solve this problem, the DSM-4TR came up with a really innovative 5-axis system. Think of it like 5 different layers of information. Axis I is for the main clinical issue, like depression. Axis 2 covers more long-term underlying issues, like personality disorders. Axis 3 lists any other general medical conditions, like diabetes, that could be relevant. Axis 4 notes major life stressors, losing a job, a divorce. And finally, Axis 5 gives an overall rating of how well the person is functioning day to day.
So what's the big takeaway here? Well, by using all 5 of these axes, clinicians get what's called a biopsychosocial assessment. And that's the key. It's a holistic view that looks at the biological factors, the psychological factors, and the social factors in a person's life, all at once. It just creates a much richer, more complete picture of a human being. And it is so vital to remember that these systems are not carved in stone. Science is always evolving. And because of that, our whole way of thinking about diagnosis has changed dramatically over the years. See, older systems use this really rigid thing called a diagnostic hierarchy. If you had a diagnosis that was considered more severe, like an organic brain disorder, it would automatically rule out a lesser diagnosis, like an anxiety disorder. The goal was to find one single primary label. But today we recognize comorbidity, which is just the reality that people often have multiple conditions at the exact same time, and acknowledging that is absolutely vital for effective care. And this quote from the source material just sums up that shift perfectly. The whole focus now isn't on finding one neat little box for a patient, but on identifying all of their needs without worrying about some old-fashioned hierarchy. It's a much more patient-centered way of thinking. Which brings us to our final thought. The maps of the mind we use today are, without a doubt, the best we've ever had. But they are constantly being redrawn. As neuroscience and our technology give us these increasingly detailed, incredible images of the brain itself, how will that change the very borders we use to define these conditions? That right there is the exciting frontier for the future of psychiatry. Thanks for joining me.